All right, anatomy class, welcome to your first set of notes for chapter 7, the skeletal unit. I'm going to do our whole chapter this way. You can pause the recordings at any time. You can go back to view them at a later date if you feel that's what's best for your studying, but really it's completely up to you as to how you take these notes. I do want you to take some sort of notes to make this PowerPoint a little more brief for your own study purposes, and I'll give you a grade for those. But I'm going to try to keep all these videos reasonably short, hopefully about 20 minutes or less, and it should be a good time. So we're going to jump right into the skeletal system. So this whole chapter we're talking about bones. Bones serve several functions, most of which are pretty obvious. Support and protection, right? Support is the fact that your body is not a little puddle of jello on the floor. You're, of course, standing upright or sitting upright. That's largely due to your bones and the muscles working on those bones. Protection. Bones are very strong. They give the shape to your head and protect the very valuable brain. They support your body's weight, of course, and you also have these ribs and the sternum that will protect your lungs. They'll protect your heart. You even got a couple little extras down here to help protect those kidneys. So they're really important organs that you just can't do without. Heart, lungs, brain, those sorts of things are very nearly encased by bone, and that keeps them safe. So the next thing that bones do is they move us. Bones basically work as levers, and the muscles pull on those levers to make you move. Okay, so speaking and walking, even breathing or maintaining your posture in a chair, those are all little body movements that are regulated by your muscles, and those muscles are pulling on bones to maintain those things like posture and movement and that kind of stuff. And so we move our body mostly due to muscles pulling on bones, and so that's another very important function of bones. So another function, our third function, is what's called hemopoiesis, which is kind of a lengthy word for the process of making new blood. Now, as an adult, this is going to happen in different places than when you're a kiddo. So when you're first formed and you're a little teeny tiny embryo, you will make a lot of your blood cells in a yolk sac. And when you become an infant and a toddler, you are going to make a lot of the blood in your liver and in your spleen. And then when you're an adult and you have these big hollow cavities, you are going to have red marrow and yellow marrow. And that red marrow is going to be in places like the skull, the ribs, your sternum, clavicles, vertebrae, and pelvis. So a lot of bones that aren't necessarily long bones like your typical bone might look like on a cartoon or Halloween decorations or something like that. These sort of odd-shaped bones like the pelvis and the skull, those are going to be making new red blood cells and white blood cells all the time when you become a young adult and adult. So, for example, the age when you might take anatomy and physiology. The bone marrow transplant is a procedure that we can do that can help patients who are undergoing some sort of disease or disorder where they've disrupted this normal process of making more blood cells. We can give them a new red marrow transplant, and that can sort of help with making more blood cells. So that's I guess one application of many for why bone marrow is very important. So here's a graph. I had a student one year ask me, when exactly does the change occur from being a kiddo who makes blood in a yolk sac to being an adult who makes it in their bones? And I said, that's kind of a complicated question. And here's the answer to your question. This is cellularity. Okay, so what percent is of hematopoiesis is going on where? And then this is fetal months from conception to about 9 months along the line. Somewhere in that 40-week time frame comes birth. And then these are years, you aging. Okay, so first couple months of embryonic development is going to be a yolk sac. And about month 2, whoopsies, I clicked by accident, liver and spleen are going to start to take over. So as yolk sac tapers off pretty quick, liver and spleen start to take over, and bone marrow starts to be formed about halfway through pregnancy. And so as that bone marrow starts to take off, where the liver comes to an end, the bone marrow is increasing. Now we get a little bit made in lymph nodes, and that stays pretty minimal throughout life, really. But the bone marrow now is going to differentiate once you are prenatal to postnatal. So now you have been born. Your vertebrae and your pelvis are doing the majority of this work, and they've color-coded them on this diagram, which I really like. Your sternum does a lot, especially when you consider how small it is. It's just this little tiny bone right here. Actually, it's 3 bones right here, and that's doing almost half the job, which is kind of cool. Ribs right here, and the tibia and the femur drop off really, really fast. And so they don't really become all that terribly significant. But a lot of these other bones, vertebrae, pelvis, sternum, and ribs, that's pretty much where your red blood cells are made and your white blood cells are made. So that's kind of a cool deal. So other bone functions, there are a few more. Inorganic salts. So we store inorganic salts in our bones like calcium, phosphate, magnesium, sodium, and potassium. And if you have excess calcium in your diet and your blood, you can store it in your bones for later. If your diet and your blood is deprived of calcium, we can take it from your bones and use these ions for just a number of other jobs in the body. And so that's kind of a nice place where we can deposit and withdraw inorganic salts. Also, a fun fact, a reason the Game Fish and Parks, National Park Service don't like people to take deer sheds or elk sheds out of the forest is because those deer and elk sheds are made of a lot of calcium and phosphate. They're bone after all. And believe it or not, it takes a while, but with rain and hail and freezing, those bones will actually degrade and decompose. And that calcium and phosphate and these inorganic salts will actually be returned to the soil. And that'll be good for plants. So it's kind of a cool cycle there. All right, so now we're in the skeletal system. We've got the functions down, and we are going to look at how we can differentiate this into regions. So altogether, when you're an adult, you should have about 206 bones, and we call them organs in this chapter. 206 different organs in the skeletal system. And we divide it up with this really logical thing called axial and appendicular. Okay? Axial skeleton is the skull, which is your cranium, which means the stuff that holds your brain in, and the facial bones right here in front. Then we have the hyoid, which is a free-floating bone in a skeleton. It's not really in your body, of course, but it is the anchor for your tongue. So, muscles have to act on a bone, and the bone in your throat that your tongue attaches to is called the hyoid bone. And then your vertebral column right here, which is all your vertebrae running all the way down to sacrum and coccyx. And then the thoracic cage, which is the ribs and the sternum. And so what we're basically saying is, you might have heard that the earth rotates about its axis. So it's a central line we can draw through the earth. And this for a human, we kind of look at the same thing. We're like, okay, what are the bones that would make up the central line through a human? And we say, okay, ribs, vertebrae, skull, sternum. And then we look at these green and we say, okay, what are the appendages hanging off of the axis? That's our appendicular skeleton. So I would like you to know what bones make up the axial skeleton and what bones make up the appendicular skeleton. And so here is the appendicular skeleton. So your arms and your legs. And I suppose you could say your hips as well. We're going to have to get in a little more technical terms for this now. But we separate them into girdles. There's the pectoral girdle, which is, think pec, is the major muscle in the chest, pectoralis major, pectoralis minor. So the pectoral girdle are the bones connected to the chest. And the pelvic girdle, the bones connected at the hips. And so our pectoral girdle is our first example of a big piece of the appendicular skeleton. And it's both arms, of course, and it's going to connect our upper limb bones to our axial skeleton that runs up and down the middle of a human. And it consists of 2 scapulae, which is right here and right here, and 2 clavicles, okay? What you'll commonly hear called the collarbone. If you hear somebody, they broke their collarbone, we now call this clavicle. So then your upper limbs are a little more obvious because they're very obviously hanging off of the body, are going to be the humerus right here, the radius on the thumb side, the ulna on the pinky side, the carpal bones, the metacarpals, and the phalanges right here. So I know it's phalanges, not phalange. Okay, phalange, plastic valve on a toilet. Phalange, finger. There's a huge difference, okay? And we'll get into naming each of these bones and their structures. So as we move along with this, please feel free to use your anatomy, skeletal terms to know list. That would be a benefit to you. All right, so let's look at the pelvic girdle. This is going to connect the bones of our lower limbs, so our legs, of course, to our axial skeleton in the middle of the body. And this is two coxal bones, okay? So the coxae are hip bones. Now, this is actually 3 different bones fused together. So we'll get into that later, but for right now, know coxa is hips, and so 2 hip bones for right now, that'll work. And then these are connected to the sacrum. The lower limb starts off with a femur, and then a tibia, a fibula. The patella is buried in here. You have tarsals in the ankle, metatarsals, the flat-ish bones of your feet, and then phalanges again, which are these little bottom, the toes, the part of your foot that you can, I guess, curl up in your shoe. That would be phalanges. Metatarsals aren't going to curl up. So that would give you kind of a basis of where metatarsals end and phalanges begin. And so certainly this diagram's a good one to know. All right, so we're going to stop there for now with the axial and the appendicular skeleton right here, and we will jump into a little bit more bone physiology and how we name certain structures on bones next time. So thanks for your time.